You know what? A 78-year-old man has been left disabled for life because of a stroke. This morning, one of my longtime patients, Mr. Harold, 78 years old, was rushed to the hospital. He'd suffered a massive stroke and is now paralyzed on the left side of his body. What's heartbreaking is that he had a clear warning sign just 2 days ago. He suddenly couldn't find the right words during a conversation with his wife. He laughed it off, said he was just tired. They had no idea that was the first sign of a stroke. This happens far too often, and it's exactly why you need to know what to watch for before it's too late. Harold's story is tragic, but sadly, not uncommon. That brief moment when he couldn't find the right words, that wasn't just tiredness. It was a red flag. A stroke whispering before it screams. And that's the problem. Too many seniors ignore this one subtle sign. It doesn't hurt. It doesn't last. But it means your brain is in danger. In this video, I'm going to show you exactly what that symptom is, why it happens, and what to do the moment it appears. Because knowing this could mean the difference between life and lifelong disability. So, what exactly is a stroke? A stroke happens when the blood flow to a part of your brain is suddenly cut off, either by a blockage or a burst blood vessel. And when that happens, brain cells start to die within minutes. That's why it's so dangerous. The longer the brain goes without oxygen, the more damage is done, and that damage can be permanent. Strokes are one of the leading causes of death and long-term disability for people over 60. But here's the thing. Most strokes don't just strike out of nowhere. The body often gives you warning signs. You just need to know what to look for. Most ignored symptom. There are many signs of stroke, but the one that's most often ignored is this: sudden trouble speaking, understanding, or confusion. Let's say you're having a normal conversation. Then suddenly the words just won't come out right. You might slur your speech, use the wrong words, or struggle to finish a sentence. Or maybe you're on the other side, listening, and things just stop making sense. It's like your brain isn't connecting the dots anymore. This symptom can last a few seconds or a few minutes, and that's exactly why people often ignore it. It doesn't seem serious. It's easy to explain away. Maybe I'm just tired. I haven't had my coffee yet. I'm getting older. I forget things sometimes. But that's the danger. Because, in many cases, this moment of confusion is the brain's early cry for help. It means a part of your brain, the one that controls language, is being starved of oxygen. And if you wait too long, the damage becomes permanent. Let me tell you about Harold, the man I mentioned earlier. 2 days before his stroke, he was sitting at breakfast with his wife. She asked him a simple question. "Do you want toast or eggs today?" And he just stared at her for a moment, confused. Then he answered, I want the heat box, the bread thing." He laughed it off. So did she. They figured maybe he just hadn't slept well. But that was the moment. That was the sign. That small slip was his brain struggling, already under attack, and 2 days later, he collapsed. When he woke up in the hospital, he couldn't speak at all, and he never fully regained his language. Why do seniors ignore it? There are a few reasons. First, as we age, many of us get used to small mental lapses, forgetting names, losing track of what we were saying. That's normal. So when a real warning sign appears, it blends in. Second, this symptom doesn't always hurt. There's no sudden collapse. No pain. Just a moment that feels off. And then it passes. Lastly, people don't want to make a fuss, especially older adults. We tell ourselves, "I'm fine. I don't want to bother anyone over nothing." But this isn't nothing. Even a few seconds of slurred or jumbled speech should never be ignored, especially if it's sudden and unusual for you. How to recognize it immediately. Here's what to watch for. Slurred or slow speech. Inability to find the right words. Speaking. Nonsense or unrelated words. Trouble understanding what others are saying. Sudden confusion or blank stares during a conversation. If any of these happen, even briefly, act fast. Call emergency services. Don't wait to see if it passes, because if it is a stroke, you may have only minutes to prevent permanent damage. What to do? Immediately. If this symptom appears. If you, or someone near you, suddenly has trouble speaking, becomes confused, or can't understand simple words, don't wait. Don't try to walk it off. Don't wait to see if it goes away. Don't lie down and rest. Here's exactly what you need to do. Step 1. Call emergency services immediately. In the U.S., that means dial 911. In most European countries, dial 112. Be clear. Say, "I think this might be a stroke." Emergency responders are trained to act faster when stroke is suspected. Stroke is a medical emergency. The faster you get help, the better your chances of recovery, and in some cases, survival. Step 2. Remember the time the symptoms started. Doctors need to know exactly when the symptom began, even if it was just confusion or speech slurring. This helps them decide if clot-busting medication, like TPA, can be used, which must be given within 3 to 4.5 hours from symptom onset. Tip: write it down or tell the paramedic immediately. Step 3. Keep the person calm and seated. Don't let them walk or drive. Don't give them food, drink, or medicine. Stay with them and talk slowly, even if they don't respond clearly. Do not wait for other symptoms. You don't need to have face, drooping, or arm weakness for it to be a stroke. Just trouble speaking or sudden confusion is enough. Many strokes begin with just one warning sign, and this one, trouble speaking, is among the most dangerous because it's easy to miss and often ignored. Every minute during a stroke, the brain loses an estimated 1.9 million neurons. After 1 hour, you could lose as many brain cells as you would in over 3 years of normal aging. But if you get help fast, doctors can restore blood flow, minimize damage, and in some cases, reverse symptoms completely. You might feel unsure in the moment. You might feel scared, but trust this: it's better to be wrong and safe than right and too late. If something feels off, especially with your words, thoughts, or understanding, make the call. It's not overreacting. It's taking control of your future. Other early warning signs you should never ignore. Sometimes stroke symptoms fall outside the FAST acronym. Watch out for sudden numbness or weakness, especially on one side of the body, in the face, arm, or leg, sudden trouble seeing in one or both eyes, blurred, darkened, or double vision, sudden severe headache, especially if it feels unlike anything you've had before. Sudden trouble walking, loss of balance, dizziness, or lack of coordination. Sudden confusion or inability to understand simple conversation. If any of these symptoms appear, even just for a short while, treat it as a medical emergency. Mini strokes, silent but serious. Sometimes these symptoms last only a few minutes, then disappear. That's called a TIA, transient ischemic attack, or mini stroke. It might feel like nothing happened, but in reality, it's your body giving you a final warning. 1 in 3 people who have a mini stroke will have a full stroke within a year, many within just days. Don't ignore the first whisper. When in doubt, get checked. You don't need to have every symptom. Even one is enough. And if you ever feel unsure, just make the call. Let the doctors rule it out. Doi Jai La Fan 7. Prevention tips, daily habits, foods, etc. Viet de hieu, tich kuk, fu hop, voingoi kao toi. O mai va chao au, nan man kach han jong jon gian nuhung hiu, kwa je fong tran jot kwai. Prevention tips. Simple habits that help you avoid stroke. Here's the good news. While strokes are serious, many of them can be prevented, often with simple changes in your daily life. It's never too late to start protecting your brain. Let's go over the most effective ways to reduce your risk. Eat for your brain. Your diet has a big impact on your blood vessels and your risk of stroke. What to eat more of? Leafy greens, like spinach, kale. Berries, rich in antioxidants. Whole grains, oats, brown rice. Fatty fish, like salmon, mackerel, great for brain health. Nuts and seeds, walnuts, flax seeds, almonds, olive oil, instead of butter or margarine. Foods to avoid or limit. Processed meats, like bacon, sausages. Foods high in salt can raise blood pressure. Sugary drinks and snacks, fried or fast food, trans fats and hydrogenated oils. Think of your food as medicine. Every bite can either help your brain or hurt it. 2. Move your body. Every day. You don't need a gym. Just walk 30 minutes a day, even in small chunks. Dancing, gardening, stretching, all count. Movement keeps your blood flowing, your heart strong, and your blood pressure under control. The best exercise is the one you enjoy and can do consistently. Start where you are. Even 10 minutes is better than none. Watch your blood pressure. Closely high blood pressure is the one risk factor for stroke. Aim for a normal reading, around 120/80 millimeters Meg. Unless your doctor advises differently. Check it regularly, at home or at a pharmacy. Stop smoking and limit alcohol. If you smoke, talk to your doctor about quitting. It's never too late. Alcohol. Keep it moderate, no more than 1 drink. A day for women, 2 for men. Manage stress and sleep well. Chronic stress and poor sleep increase stroke risk. Try deep breathing, meditation, light walks, or listening to calm music. Aim for 7 to 8 hours of sleep per night. Your brain needs rest and peace just as much as it needs food and exercise. Take your medications seriously. If your doctor has prescribed medication for high blood pressure, cholesterol, or diabetes, take them as directed, even if you feel fine. Skipping pills can silently increase your risk over time. Keep your brain active. Read, play memory games, learn new things. Keeping your brain sharp can help reduce cognitive decline and support overall health. You don't have to be perfect, just be consistent. Small changes, one healthy choice at a time, can add up to a longer, stronger life. Now you know the signs. You know the risks. And most importantly, you know what to do. If you or someone near you suddenly has trouble speaking or seems confused, don't wait. Call for help immediately. Take care of your health every day. Eat well, stay active, and check your blood pressure. And if this video helped you, please like, share, and subscribe. Someone you know might need this more than you realize. Your brain is worth protecting. Start today, and don't ignore the warning signs.